In this video, I'll shed more light on the importance of shoe screening. This method can be valuable to health professionals and even the individual who is eager to learn more about how the repetitive function of the lower extremity influences shoe wear patterns. So let's get started. We're going to look at the relationship that shoe wear patterns have with foot posture and gait. And remember, your shoes are always speaking to you. So let's go ahead and look at the concept cornerstone.
First of all, if your shoe is wearing out, it doesn't mean that you necessarily have faulty posture or gait. Our shoes will eventually wear out. So we just need to understand the differences between what's normal and what's not. Secondly, shoe screening is a valuable method in identifying the possible causes of faulty foot posture or gait. And once you identify these faults, this can assist you in making proper treatment choices. Shoe screening also helps you evaluate the effectiveness of the treatment, coupled with other measures such as pain, function, or even quality of life. The other reason is that it helps us to distinguish the differences in gender, age, and foot gear. For example, the adults and the children will usually walk with a wider base of support because of balance issues, and then the males may wear heavier shoes than the females, maybe because of occupation, and some females may go for very soft shoes or even high heels. All of these can lead to differences in foot posture, and this will be reflected in the way the shoes wear out. Last but not least, it's important to remember that biomechanical dysfunction in the feet can have significant effects on the knees, the hips, the pelvis, and the spine.
Let's move to the biomechanics. Under this, we'll take a brief look at the kinematics and kinetics involved. So what are these kinematics and kinetics? By simple definition, kinematics are mechanics concerned with the motion of the object without considering the forces causing the motion, while kinetics are concerned with the forces causing the motion. Under kinematics, we'll concentrate on gait, muscular activity, and joint motion in the lower extremity. The kinetics will be centered around the ground reaction forces and the center of pressure in the foot. So, what is gait? This is simply the act of walking, and it has two basic requisites. The first one is the periodic movement of each foot from one position of support to the next. And the second one is that there should be sufficient ground reaction forces applied through the feet to support the body. These two elements are necessary for any form of bipedal walking to occur, no matter how distorted the pattern may be by underlying pathology. The picture on your screen shows a normal gait cycle. Using heel strike as the starting point and the right leg for reference, we can say that a complete gait cycle is from heel strike of the right leg to the next heel strike in the same leg. The gait cycle consists of the stance phase, which is the phase during which the extremity is in contact with the ground, and the swing phase in which the same extremity is no longer in contact with the ground. The stance phase occupies 60%, while the swing phase occupies 40% of the gait cycle. Under the stance phase, we have heel strike, foot flat, mid stance, heel off, and toe off. And under the swing phase, there's acceleration, mid swing, and deceleration. In normal gait, there is a natural symmetry between the left and right lower limbs. This means your left lower limb should have the same proportion of the stance phase and swing phase as your right lower limb. But in pathological gait, an asymmetrical pattern often exists. In this picture, we can see the gait cycle proportions of a normal man. He has equal distribution of each phase in the left and the right lower limb. However, The gait of the patient with avascular necrosis of the left hip reveals that he's spending more time weight bearing on his right limb as compared to the painful left limb. The same goes with the patient with osteoarthritis of the left hip. Even though there seems to be a normal distribution of the phases in the painful limb, that is 60% stance and 40% swing phase, this patient definitely has an asymmetrical pattern because he spends 80% of his cycle time weight bearing on the sound limb. In both cases, the patients spend less time bearing weight on their involved limb and have increased cycle time compared to the normal subject. We move on to muscular activity. Again, with reference to Inman et al. 1981, there are 7 major muscle groups active during the gait cycle. These are the gluteus maximus for hip extension, gluteus medius for hip abduction, the adductor magnus for hip adduction, the quadriceps for hip flexion and knee extension, the hamstrings for knee flexion, tibialis anterior for ankle dorsiflexion, and the gastrocnemius for ankle plantar flexion.
Now, it's very important to understand or to remember that during the stance phase, there's a closed system called the closed kinematic chain, or CKC, where one end of the chain remains fixed so that motion at one joint will influence motion at all of the other joints in the system. Therefore, weakness or tightness in any of the muscle groups directly or indirectly involved in gait results in changes in muscular recruitment and can cause a faulty gait pattern. These muscular imbalances can be as a result of several factors such as pain, misuse, deformity, diseases, prolonged immobilization, injury, neurological deficits, and poor posture, just to name a few. Now, when it comes to joint motion, the joint motion considered here is of the foot and ankle. Remember, this is highly variable on the person, the foot gear, as well as the terrain. However, the general features described here are those of a person with bare feet and on a flat, non-slippery surface. In the early stance phase, that should be the moment your heel touches the ground, the foot slightly supinates or inverts, then pronates slightly during the mid-phase, and again supinates during the late push-off. So you have the foot slightly supinating, slightly pronating, and then slightly supinating again. In the transverse plane, the forefoot will abduct a few degrees in early stance and then adduct during push-off. I'll explain this a bit more when I talk about the center of pressure. Remember, these movements occur in conjunction with dorsi and plantar flexion of the ankle.
Finally, let's take a brief look at the kinetics, that is, the ground reaction forces and the center of pressure. The ground reaction forces are the forces being applied to the foot by the ground when a person takes a step. Just remember Newton's third law. To every action, there is an equal and opposite reaction. For example, when you step on the floor softly, the ground reaction forces will return an equal amount of force to that part of the foot that is in contact with the ground but in the opposite direction. So, if you step hard, the reacting magnitude of force will increase accordingly, and if you step softly, the magnitude will obviously be less and in the opposite direction. The center of pressure is the point where the floor-foot forces act, in short, the FFF. This is the point where the forces between the foot and the floor are highly concentrated during a particular point in the stance phase. The center of pressure moves along a path during gait and produces a characteristic pattern. This will differ during barefoot walking and when various types of footgear are used. In barefoot walking, the center of pressure starts at the posterolateral edge of the heel at the beginning of the stance phase. You might want to relate this with the slight supination that takes place during heel strike, because we can see that the center of pressure at this point is on the posterolateral edge and not in the middle or medially. The center of pressure moves in an almost linear manner through the midfoot area. Here, it remains lateral to the midline, so your foot may still be slightly supinated, but preparing for pronation. At some point, it crosses the midline where pronation takes place, and then moves across the ball of the foot. Here, it is slightly concentrated along the metatarsal break. The center of pressure then moves to the second and great toes during heel off. In this case, we assume that the foot is still slightly pronating. During the last phases of toe off, the foot supinates again in preparation for heel strike. Okay guys, thank you so much for watching. That's the end of part 1, but if you want to learn more about the specific faulty biomechanics and gait that accompany specific shoe wear patterns, be sure to watch part 2 of this video. Also, don't forget to subscribe, to like, share, and comment.